Hi, I'm Dr. Janjua. I'm a board-certified facial plastic surgeon. I practice in Bedminster, New Jersey. I'm making this video for information purposes for my own patients and maybe even other individuals. And this is about the fillers. Presently, there are a lot of fillers on the market. In my own practice, I only use 4 kinds of fillers. Fillers are materials that can be used to plump up the face in certain areas where there are wrinkles, grooves, or depressions. There is a lot of confusion as a lay person as to what filler is the best to use. I would like to educate you and give you some information of what I know about the fillers in my practice. I will first start with Juvederm. This is Juvederm package, and this is the Ultra XC. Juvederm is hyaluronic acid, which is a naturally occurring material in our body. It is very soft. It is a clear gel, and I will open up and show you the syringe as well. And it is made from natural sources, and hence the risk of any reaction is almost non-existent to very rare. It is very good to inject in the lip area where you need more definition, you need soft material, and it lasts for about 6 months. And in some cases it might last up to a year, but that is not the norm. It can be used anywhere on the face where you see wrinkles and grooves, and it works very well. However, in my practice, I found the best application for Juvederm to be in the lip area to provide definition, to provide volume, and the other location that I find it very helpful is what we call the tear trough, which is right here where the tears run down. And once you fill this area up with Juvederm, it helps a lot in making it look like you don't have any bags. Next filler in my practice is Restylane. This is the package for Restylane, and I will show you the inside as well. Restylane also is hyaluronic acid. It is made by a different company, so the formulation is a little different, but essentially both materials are very, very similar. You can see the clear gel in there, and it is used in my practice for same purposes as Juvederm. These 2 fillers have been around for a long time. They're very reliable, and they give instantaneous result. When you inject an area, as soon as you're done and finished, you can see the result. And that is a nice thing about it. Both of these last up to 6 months, and maybe up to a year in some cases. Next filler in my practice is Radiesse. Radiesse is made from calcium hydroxyl apatite, again made from natural sources, so the risk of reaction is very, very small. The material is a little different than hyaluronic acid. Actually, I should say a lot different, because it is white in color and it is a little bit thicker in consistency than Juvederm and Restylane. However, it is very good in terms of its longevity. It does last up to 1 year, and it can be used effectively in areas of the face where you need volume. And typically in my practice, I use it to build up the cheek areas, the grooves, and I do not mean the fine grooves which are this part of the smile lines, but the deep ones over here. Also in the chin area, and it seems to help build it up right away. It lasts typically for up to 1 year. Being a little thicker, it might feel a little bit more hard or firm in the few days after injection, but after that it blends in and you can barely feel it, and you get used to it very fast. Since it is made out of calcium, if you were to do an X-ray of your face, you will see it for a while in the face, although it does not have any known bad effects. And that is the material of choice for giving instantaneous buildup in the cheek area, deep grooves, and this area. After Radius, the next filler in my practice is Sculptra. Sculptra is very different. Sculptra Aesthetic comes in a box like this. It is more of a collagen stimulator as opposed to a filler. A filler plumps up the face by method of its own volume, almost like water. When you inject water, it fills up the area. As long as the water is there, it looks filled, and then it's gone. Same with Radius, Restylane, and Juvederm. As long as the material is there in the body, under the skin, you have the result. Once the body absorbs it, it goes away. Sculptra makes you produce your own collagen. The ingredient in Sculptra is poly-L-lactic acid. It says injectable poly-L-lactic acid. If you look at the bottle of Sculptra, in one box we get 2 vials. It comes in powder form. That is the powder in there, and it has to be mixed in preparation. It's white colored powder. So this powder is mixed with water, sterile water, and then it is used to inject in the face. The purpose is to inject Sculptra in the areas where you have lost volume in the face. Once injected, in a few days the water gets absorbed, and then you do not see any effect at all. So essentially about 3 to 4 days after the injection with Sculptra, you will look just the way you did when you walked in the door. However, in about 2 weeks, a change starts happening where the particles or the granules of Sculptra start stimulating your own collagen production. So you start seeing a little bit of mild puffiness. In about 1 month, you can see those areas puffed up a tiny bit. It is not a dramatic change. If you were to use 1 vial of Sculptra, in my experience, you see about a 20% improvement in 1 month in the overall appearance, and that's the most, not a lot. However, it is happening from collagen production by your skin, and that makes it very natural, that makes it subtle, and it makes it last very long, since your own collagen does not degrade very fast. And it can essentially last for up to 2 years, and in some cases maybe up to 3 years. And that's what makes Sculptra very unique and different from other fillers. This essentially is a recap of all the fillers in my practice. I want to remind you that there are many fillers out there, and the goal is to understand them so you can make a good choice about what filler to use for your own face. The way I help my patients decide is, if it is in the area of the lips, then there's no doubt it should be, in my opinion, hyaluronic acid based fillers such as Juvederm or Restylane. If it is for immediate buildup of cheeks or deep grooves or deep areas here and here, because you have an important function or event that you want to appear really good for, then Radius would be a good choice. If you want to maintain your facial appearance over years to come, and you want to build it up slow and gradual and maintain it for a very long time, that would be Sculptra. Essentially, Sculptra is proactive and other fillers are reactive. This essentially ends the introduction on these fillers, and I welcome you to visit my website at janjuafacialsurgery.com. And I hope this helps you, and I hope that you discuss this information with your own physician in more detail and make a good choice and an informed decision. I thank you for your time and attention.